The Minister for Regional New South Wales and Deputy Premier John Barilaro joins us now. Deputy Premier, thank you for speaking to us on ABC News. Why has the statewide lockdown come into place at this point in time? Why not earlier?
Well, good afternoon. Well, firstly, we've been monitoring what's happening in regional and rural New South Wales. We've seen the numbers coming out of Dubbo overnight, and we've had some further numbers this morning that the health team have relayed to the crisis committee, to the Premier and myself. We were looking at a number of extra LGAs, but then when you put into account the other LGAs that are already in lockdown, we've got issues possibly through our sewage surveillance in areas that at this stage there are no known cases. So this was appropriate. We've always said that if we thought this measure was needed, we'd act quickly, and that's why on that advice at lunchtime today, we made the decision to go to a statewide lockdown for regional rural New South Wales.
And what will that mean for regional communities? Because naturally for those people living in those communities, not people visiting from other areas, there are services that they might have to have travelled for across wider distances, vital services and things like that. So how will this lockdown actually come into a place and be affecting those communities?
Yeah, so there's in place a number of stay-home orders, and within those orders we also are quite prescriptive in what's open and what's not. But in real terms, we are closing schools for the protection of our children, so that schools will be closed for the 7 days. But outside of that, what we're saying that if you have to go to work and you can't work from home, you can leave your home to work, and there's no distance that you're allowed to or not allowed to travel. Supermarkets, goods and services that are essential will remain open. Of course, you can go visit for care and compassion of relatives, of parents, of family, and the other stay-home orders stay in place. So service delivery that are essential will continue. Going to the GP, to the doctor to get your vaccination shot or get tested, all that is all permissible under the stay-home orders.
Now, for those communities that are on the border, particularly the northeastern part of New South Wales, where there's been a lot of trouble in times past around how lockdowns and stay-at-home orders operate, what are the measures for those communities on the New South Wales-Queensland border?
Yeah, so look, we've got issues on all our borders. Victoria have made it very clear about regional and rural New South Wales and treating New South Wales as a hotspot, as the Queensland government has done up there. There are systems in place for those border communities. The ACT went into lockdown late last week, a couple of days ago, which impacts on those southern border communities. And we've got those arrangements in place to deal with those border issues. And it is at times difficult because different governments have different approaches, but up to this point we've been able to work within what we call border bubbles to streamline those conditions and those restrictions and keep people and society functioning as best as possible.
How well prepared are regional communities to deal with the outbreak potentially, becoming worse and the impact on health services in those communities where usually they're already stretched to the limit, just dealing with everyday health matters. So how well prepared are those communities to deal with an upscale in cases and potentially people becoming very unwell?
Yeah, so part of the decision to lock down is a precautionary measure, and it's to make sure that we don't become overwhelmed. Now, we've got resources, and we've got the ability to move resources around where there's need, as we did this week in Walgett. But the reality is a lot of our small regional communities don't have an ICU unit, so we would be transporting patients from little towns to some of the major centres. We do have plans in place. We've been planning for this forever and a day since the start of the COVID pandemic 18 months ago. But at the same time, what we don't want to see is those very limited resources being overwhelmed. And that's why today's decision, in a way, is to make sure we don't become overwhelmed, that the health system can keep up, continue with vaccinations, continue with testing, and of course making sure that we deal with those that get infected. So we're confident we can manage it, but part of the tool is also locking down.
Now, we also have seen a number of changes to restrictions for different parts of New South Wales, in particular Greater Sydney, especially around travel and permits and those sorts of matters. What sort of measures are in place to ensure compliance, particularly out in those areas where, it's hard to see where people are at? It's a remote community or a rural community where it's harder to keep across who's coming and going in those areas.
Yeah, well, the first thing is to make sure that you deal with the areas that you have a virus or where you've got a spike. And Sydney is the epicentre and parts of Sydney are of concern. So today's announcement with the measures that Commissioner Fuller has put in place from a permit system to leave Sydney, limiting the reasons you can leave Sydney, and the increase in surveillance and resources on the ground on those main roads, making sure people don't leave Sydney. That's the first part of this. In the regions, we know that mobility is something that occurs. We do travel from LGA to LGA, town to town, but police will be out and about, making sure people abide by the rules. Our focus is for people to stay home and to do the right thing, because if we do the right thing, as we showed previously in Orange, we can actually get out of this in 7 days. That I have no concern that we can't be out of this next Saturday, and that's by doing the right thing. But police will be out and about on the beat. And, we work with communities. It's not always with the stick. It's about working with our communities, understanding that for some communities, this is the first time they've probably been in a lockdown scenario. So people may make genuine mistakes, and we'll work with them. But look, the message clearly, if we stay home over the next 7 days, we'll be out of it.
So looking to 7 days, should it though extend further, because we have seen that necessarily had to be applied in some parts of New South Wales, clearly Greater Sydney as well. What's in place for those people who are struggling financially, for businesses who won't be able to operate?
So one of the things that we've done well in New South Wales, when the business packages were announced, the JobSaver, the grants, the support and even the disaster payments, we made it statewide. It wasn't actually just for Sydney, because of course Sydney is such a major population. A lot of our tourism businesses in the regions, for instance, have been struggling off the back of the lack of tourism, the lack of movement from Sydney to the regions. So those businesses have previously been have met the criteria to get financial support. Well, the lockdown in itself just reinforces that. So there is business support. There's support to support businesses to keep employees. The JobSaver program, grants. They need to get onto the Service New South Wales website. You'll see all the forms, all the links, and you'll be able to get that assistance.
Now, we have had it suggested today by the Premier that it's going to be a difficult September and October. How challenging is it for people to continue with, the level of uncertainty that's played out? And of course, today's numbers, we're seeing 466 new locally acquired cases reported across New South Wales today, and still the number of people infectious in the community. It does not appear that we are winding back this situation, the outbreaks spreading further across the state. What's the outlook?
Yeah, look, as a member of the Crisis Committee, being tasked with the roadmap to get out of this, one of the things that we are now looking at is lifting restrictions against vaccination rates. The Premier's been quite vocal about that. Certain levels of vaccination will give us some level of lifting, the ability to lift some level of restriction, and we're working through that, and we'll make that absolutely clear before the 28th of August, when this lockdown officially ends, before any further announcements. But the reality is that we'll still have many restrictions in place in September and October. Our projection for vaccination rates of 60, 70, 80% don't happen until the end of September, early October, and then throughout October and November. So we'll be upfront and honest with the public and very transparent about what the pathway over the next couple of months looks like. It's what the Premier has committed to, and we're still working on that, and we'll probably have more to say about that in the next week or so.
And Ms. Barilaro, on that point around vaccinations, of course, we have seen some changes to the way the rollout has had to proceed, given the number of cases in different parts of New South Wales. What now is the outlook for those regional communities where we are starting to see case numbers appear and increase? How well prepared are those regional communities to be able to roll out vaccinations?
Look, we have been prepared, and what is coming online is, of course, the pharmacies and the pharmacy network. Most of those pharmacists are getting their supply of AstraZeneca. Some have already received it, and it's rolling out. Our GP network, directly from the federal government, that continues with Pfizer and AstraZeneca, and then our own clinics. And this week we refocused our resources into Walgett, because we do know that it's a vulnerable community and its vaccination rates were lower. But I've had the data shown to me in relation to vaccination rates for Sydney versus regional rural New South Wales, and it's very, very close, except for the southwestern part of Sydney, where we're really pushing for the vaccination rate to go higher. The average is the same right across the region, so we're not falling behind. the vaccine's available, to anyone that's watching today. Don't wait, book in AstraZeneca or Pfizer or whatever you can get. It's all safe, and get vaccinated. It's the only way that we can stop future lockdowns, and it's the only way we'll get on top and beat this virus.
Deputy Premier John Barilaro, thank you very much for speaking to us on ABC News.
My pleasure, thank you.